So other side. And this would be example of ideally how you could order some of the choices as to which side first. Like dominant arm or a symptomatic arm, shoulder, neck. Do that one last. That way you don't work on the area and then have them lay on said shoulder, you know. Same principle with low back if possible. But it doesn't usually make it too bad if they end up laying back on the shoulder, but there's usually one that's bad. It's rare for a person to have both. So, yeah, where I try to be a bit more precise. Sanitized. Come around and then I just pick my order. Can't go wrong as long as you don't, poke a person in the eye. No harm has been made, and then I just kind of walk my way around from the forehead, walk my way around, focus a bit more on those temples. You know you're doing good work here. It's a good example, like you're tugging on the fascia effectively and really creating a distortion on something bigger than just where you're pushing if you see the ear move. That kind of gives me a good gauge. I'm always kind of working around the ear and I'm watching that I'm making the areas around that and ideally the ear itself change shape as I work. That guides me going all the way around to where now I'm behind the client. And drape for the shoulder. Come in. Could use a soft fist here. It helps me kind of move the hair out of the way if I had to. Transition to a palm. And warm the area up. Bring a forearm in. Pressure.
Good.
Okay. It will come with time. Like, don't get too lost in this idea of being able to find the perfect amount of pressure quite yet. Like, I promise you'll get to a point where you can start feeling about how much each area of the body needs. Some of it's based on client preference, but others you'll just kind of get a sense of like, okay, I've dented what feels like muscle tissue just the right amount. And that'll just come with like repeating it again and again. So from the base of the skull, now I'm mid-cervical. So top of the cervical vertebrae, mid-cervical, sweep around. Let the neck guide you. If you stay in contact with it as you go into the upper traps, then you won't miss. You just don't want to be picked up and coming in like this. Won't damage someone permanently, but you're going to be coming right into just the clavicle and the scapula. So just make contact with the skin of the neck, let that guide you. You can't miss. So I'm just finding where I got better placement, there. So one, just following my intuition. For some reason that feels like I'm on something that is a little bit shorter, more tight. Big deep breath. So I'm compressing it in this angle. If I shift over a little bit, now that's gonna push it more anterior. So I'll have a different sensation to it, even just from the sake of like wanting to apply different forces for it, so it feels different. By making the sensations feel a little bit different, it's going to feel more relaxing because you just don't get conditioned to the same application, the same sensation repeatedly. All right, and we're good there. That covers basically everything. There's a lot more we could do there, but as a baseline, I'm going to scale your arm. That covers all the areas you need to. And then over time you can just get more and more precise with that. So kind of just going right into my personal habits of sliding the wrist right between my thumb and index finger, hand up on the acromion of the clavicle. That's what the bony plateau at the top of your shoulder is called. It's kind of just the end of the scapula, but if you rest your hand on top of the outside of your shoulder, you can't miss it. And just down. Just feeling for making sure I'm not too much on the scapula, not pushing too much straight down to the ribs. And good deep breaths. What I liked about this too is this hand not only can be resting on top of the shoulder, but holding that sheet tight across the chest. Okay. And I can just tuck them right back in. Here, I don't have to drape for this. I can go right over even the blanket. Maybe it's a little bit of a buffer, so you can't feel quite as precisely, but if I'm going to go over the sheet a lot of times anyway, it's just sometimes it's just more practical and easy. I don't necessarily need glides in this area, I need good pressure. Pressure, that's all right?
Yeah.
Okay. Tiny, tiny, start to lift that bottom leg. That's all it takes. Hold, hold, keep holding, big deep breath. With the exhale, slowly let it down. Now I combine two things. I combine muscle energy with breathing. Okay, so that's more straight down, the L formation. If I come further back, more posterior, then I'm going to increase my elbow angle into that V. That's going to get me more on the lumbar erector spinae. I wanted to work on those, or if I ask the client and confirm that's more where the symptom was. Any one of these three could be an area that feels like it's more important, more part of the symptom, or maybe it should be just working on all three. So a little lift of the bottom leg, hold it there. By incorporating the breathing, I make them hold it longer. That's my trick. Okay, keep holding, big deep breath in. And then as you exhale, slowly let it back down. Notice all the phrasing when I'm asking for movement, small movements, slow movements. You don't need anything big, super strong, or sudden. Now, if I was looking for the SI joint, it's just the smallest pivot. And then what you're going to want to do when you're looking for stuff like this is confirm with the person, like, okay, I'm going to be searching for spots here, but I want to make sure it doesn't feel like I'm too much on the bones. So if you're down here, just offer for the people you're practicing on to give you that immediate feedback. While I'm here, I don't want it to feel like I'm too much on bone. I don't want to feel like I'm pinching the skin. All that, please tell me so I can adjust. And a little lift of the leg. Slowly down. And again, the lift. Take a deep breath in. And the way out. And let it go. Breath. And I'm just holding the lateral side of the arm and having my form kind of sit on the shoulder. Kind of just keep her from rolling too far forward. So this transitions pretty nicely. One spot straight down, one more posterior, one more posterior but also inferior going down to the SI joint. And then we're right here to work up and work on the hip. I've already identified with my forearm where the top of the pelvis is. So that allows me to just kind of skip over and know I'm going to be on muscle. The trochanter, if you are on top of that, it'll jump out at you. So if I can just identify the top of the pelvis, the iliac crest, Go down about a couple inches, then I'm into the other glutes, gluteus medius and gluteus minimus. And this is right at the edge of me being able to comfortably apply pressure. If the table were any higher, or if the client were any broader, then it would be too strenuous. And I don't want to be having to get up on my tiptoes. So in those circumstances, that's why we have the step stool, and or we actually just adjust a hydraulic table. And I'm just working my way around that greater trochanter. Compressions that start light, that's like a light compression, and then it's a deeper compression. They kind of just rhythmically rock one into the other. Light, then deeper. And down to the bottom leg. If I can find it. Here, I'm gonna scoot you back a little bit. Sometimes you gotta do that. And there you just don't make sure you drape fully yet. Contact the sheet against the knee and have them scoot back. Bunch, bunch, bunch. Great, technical terms there. Unlock the knee a little bit. That'll create some slack here. You know, it's not wrong to have the knee fully extended, but that'll make everything a bit more taut. It'll feel a little, could be a bit more sensitive for the client. It might feel a little bit more difficult for you. So the more joint movement included, the better. Now it can be with that forearm. That's my preference. So increase the angle of my elbow, more of a V formation, I'm more on the hamstrings. Step closer, more L formation. This is where I make sure my hand is directed downward. I don't need it to be up like this. I let it be more, it's even greater than 45. I mean, you can get a little inventive. There's been times when I've been trying to get on a specific spot, like up where the hamstrings attach, and I've twisted around. The sheet and everything were in the way because it creates a big clump there. So I bring the sheet down, and then I end up going in this orientation to get on a very specific. That's where the hamstrings attach up there. But I just shifted my orientation all the way around, and now I can move the knee like this. So, you know, be inventive as long as you're lined up more or less correctly, and especially if you're using the forearm, then I'm going to do nothing but say that's a great job. Here, using hands to kind of contact, warm the area up. Then transition, forearm. The non-working hand is always trying to help and support whatever jointed area is next, or at least that is nearby. And I just have to be mindful of where that step is. Some examples of like how you could change how you orient your wrist, as long as that doesn't bug, like I'm a little bit deviated towards my ulna. But this works okay for me. When the table's a little bit lower, a lot of times I'm using a soft fist here. Okay, just gather, support the top of the foot. Form really just fits perfect. Something that I strongly encourage. One, it's just so efficient, but two, if anybody has a tendency towards being ticklish, the broader the basic compression, the less ticklish it's going to be. So it's just a really good thing to get used to incorporating. more precise or targeted elements for the massage here. If I wanted to get like more sharp and specific, I don't usually bother to do it here. I'm going to do it over here. Heel squeeze, we're done. Swoop around. Okay. Punch, punch, punch. Just making sure it's contacting anterior, posterior before I move it. Good. Supporting behind the knee, forearm, anterior, lateral, not directly on the IT band. I'm thinking more the lateral quads. Three of those quads are named vastus something, and it's vastus for just where they're located. So vastus lateralis is the one I'm working on right now. When I get to supine, I can get vastus intermedialis and vastus medialis. If I had to, I could go directly on the IT band. That's usually not necessary. That's just deep fascia. So every now and again, maybe there's a little counter irritation for someone, but it's not, the tendons don't change shape, the muscles do. Here's the big pull, just pinning with my one hand and then try don't throw the leg off the edge. Good. Kneading for me works better as a lighter pressure, more superficial application. I'd rather use my forearms for deep pressure, use my hands for light pressure. So I will contact and warm everything up. And all of that would have been, one round was light and one round was deep. So that first round was light, and then this one has just a little bit more oomph, and a bit more push, a bit more pull. And you don't have to do that foot swap like I do. It could be all the same pushes and pulls, then swap, and then sometimes that just coordinates better. Depends on, some people find it much more naturally, and it doesn't matter. It's two sets of torsions. I come in forearm. Here, right on top, since we're on the lateral side of the body, those muscles are going to be related to frontal plane movements. It's not abduction, sadly, but it's ankle eversion. So little sneaky things here. If I'm thinking about an action to do that's going to increase the stress to those muscles, and I just grab a hold of that foot, and it feels like there's part of a foot massage occurring with this, right? And I just, it integrates really nicely. And when we get to someone has lower leg edema, this is a really good angle to work, because you're working on all the soft tissues of the leg. You have the leg elevated. It's not quite downhill, but it gives you such good angles. And a big part of moving any kind of swelling or blood is joint movement. I don't care what any other piece of literature says. One concept we try to reinforce for you is mimicking normal. What is the normal way the body naturally moves this fluid when things are operating correctly? For lymphatics and venous blood, it uses the change of shape of your muscles and the change of pressure and shape of the joints to pump everything. So I'm just mimicking that. Voila. Then one hand under. This is where I can get more precise if I want to. Your fingers are much stronger like this than they are like this. So curl. My main pressure, if I'm using my actual fingertips, is going to be the third and fourth, my middle finger and my ring finger, because I can bracket those with the index, the second, and the fifth. support them. And I can just hold like this and push the top of the foot down into the fingers. So if I want to find a very specific reflexology spot, I don't do it in supine with my thumbs. I can visualize that map just fine and do it like this. We'll touch in on stuff like that, but systems like reflexology, you have to have an awareness of what they are, but the concepts, the techniques attached to it are not complex. It's just following a roadmap. Bring up a picture of it and make sure you contact all the areas. The really silly thing to forever remember that is absolute bunk is that you're not going to induce labor working on the feet and the ankles. That's still out there on the internet. It's related to reflexology. It's spots around the ankle joint, and it's still out there where spas and places will restrict, especially first trimester massage, because the idea is that you're going to hit a spot in the foot and throw a person in labor, and that is really silly because the pressure of the sock and the shoe is probably doing more than I would be doing. So I call garbage science on that one. It's an absolute old wives' tale. Okay. Go here, and we're done.